got some notes this time, so a little bit organised. Just talk about CIDP, what I've gone through in the last 12 months. Diagnosed with CIDP 12 months ago. I was in a wheelchair. Yeah, it's not real good. Had some improvement, but I'm still going through it. And yeah, just some thoughts on what's going on. Yeah, you can't sugarcoat CIDP. It's pretty terrible, nasty. Just do what you can about it. Actually, a bit of background. I've kind of had a triple whammy. I lost my wife to breast cancer 3 years ago next month. So that was 2 years before I got CIDP. Don't have any home support, so cancer is something you die from, of course. So CIDP shouldn't kill people, but it disables you. That's how it is. So yeah, it's still going through that. I must be a pretty unlucky person, because in October 2018 I done a joy flight in a tiger moth, and the tiger moth had to make a crash landing on an unmade road. Myself and the pilot were unhurt. Scary stuff. How unlikely is that? And about 3 months after that, I got diagnosed with CIDP. So that's the triple whammy, really. Yeah, not very good, but how it is. Yeah, like I said, this time last year I was in a wheelchair, so I've improved since then. That's good. People that have been diagnosed recently with CIDP, I could explain a little bit how I've gone the last year. Everyone is a bit different, I think, anyway, but anyway, for me, well, couldn't work for a start. I'm still not working, and there's no prognosis about that yet. Your local GPs, general practitioner doctors, know nothing at all. So that's a problem. I think they look it up on their own computers. They can refer you to specialists, neurologists, what have you, but they don't really help you at all. They can, just refer you and offer support, but they've got no understanding of CIDP, really. I was affected with balance, no balance, muscle weakness, fatigue, of course. All the bad things. Could have been a bit worse, but that didn't happen. Even just holding a knife and fork, trying to eat, you've got no pressure on your knife. You're just sawing away and you can't cut anything. And your knife's sort of just useless as well. So just those things, feeding yourself. Pretty hard. One of the worst things was for about, 3 or 4 months, into 5 months, just my hands were like, touch was like coarse sandpaper. You touch anything, with your fingers and hands, palms there. Everything was like coarse sandpaper. 24 hours a day. Didn't stop. That's really, really annoying. Everything you touch, just like sandpaper. Yeah, there are some weird things with this stuff that goes on. Even now, I get, I've got tightness all around my torso here, and it's there 24 hours a day, not as severe as it has been up until really, I guess, 2 months ago. You try and sleep at night. It's not pain, but you lay down, and for me, it felt like the tightness was coming from your back towards the front, and more so on the front, where you'd notice it. And it felt like it was going to well up inside you and choke you through the night. Like, I guess tightness around your lungs area with muscles. Yeah, of course I didn't get that bad that I was going to choke, but it felt like that was a possibility, you know. And the only way I could really describe that would be like the old alien movies, where they have the alien that comes out of people's chests and attacks people, you know, blockbuster movies. It feels like a pressure just inside your chest there, and something's got to release itself. So there you go. Got an alien inside me as well. That's what it felt like for a long, long, long time, every night. 10 months, whatever. Still got a bit of it. That's all doom and gloom. Another thing is that happens to most people, I reckon, would be you get like a numb backside. You've got numb hands, numb feet of course as well, numb backside. Going to the toilet, it's not easy. You got to make sure you look. That was a long time too, months and months. Yeah, nerve repair can take years, so that's all well and good if they're not damaged too much. If they're too severely damaged, they won't repair, I suppose. Yeah, relapses are common too. I haven't had one yet, 12 months, touch wood. Don't know if I would get a relapse, but I'll have to deal with it if it happens. Apparently they're fairly common. Severe, mild, no one knows. No one can tell you what they would be like. Duration, nobody knows. So a lot of uncertainty of all this stuff, CIDP. That's all the bad things, and there are other bad things. Things I didn't get. Vision problems, I didn't get that, so that was okay. And disabling pain, I didn't get that either, so that's a real bonus. And there's other things too, but I didn't get that stuff. I certainly couldn't walk. I wasn't told that I would walk again. And I thought just being on a walking frame was a big improvement from where I was. I couldn't leave my room in the hospital unless I was in a wheelchair. So, and no one would tell you if it was going to improve. Anyway, I improved, which was good. So now I can walk unaided, balance is good, all my balance has returned. I've had no falls, made sure I had no fall, well, as much as possible I made sure I had no falls. So that worked out. I can use my fingers on taps, zippers, do shoelaces. Couldn't do any of that before. Now I'm normal for that, I'd say. Well, 98% normal anyway. I can write. Couldn't write there. First couple of months. I got normal touch with my the touch sensations with my fingers and everything. That's really good to have all that back. My feet, I can feel things, so that's improved. It's like a partial paralysis. I can feel things, but they're not right. And the weakness is there, of course. Yeah, I can drive. Been driving 6 months into this diagnosis. So been driving like 5-6 months now, so that's good. I wouldn't say I'm an expert, but I'd say I'm safe. So I can drive automatic and manual car, so I can do that. I have my IVIG monthly. I've had 11 treatments so far. That's ongoing at the moment. I don't notice an up and down period before and after. I don't really notice much difference, but it's doing me good apparently, so I won't say don't give it to me. Had a nerve conduction study done a fortnight ago by the neurologist, where they put electrodes on you. Well, on me it was on my lower leg, and measured the impulses, electrical impulses, and he said it was a good improvement to the last time it was done. In the nerves he tested, showing some F waves as well, which is apparently good. So that's good. Get another one done in just over 3 months' time, so I hope it improves more. Reading my notes still. Yeah, no relapses yet, so that's good. If I get one, I have to deal with it, see what happens, but don't dwell on it. Nothing you can do about it, so don't just get yourself down thinking about it. Just worry about it if it happens. On a good note, I had a Lotto win there just before Christmas, a Lotto win, so it was a large amount, $12.60. No, that's how things go, the random nature of things. Sometimes you get bad, sometimes you get good. That's largely how I see CIDP. It's a random thing that can happen to some people. You don't make it happen to yourself or anything like that. It's a terrible thing, but it's a random thing. You could be a good person, a bad person, in between. It doesn't matter. It can happen to anybody. And it's how you deal with it that counts. What else we got? I think if my nerve conduction study shows a near normal result, maybe the next one I get or the one after, I'd like to return to work, but no one's saying that now at the moment. But that'd be a good outcome if that could happen. I've got a physical job, on your feet all day, using your hands, arms, lifting, constant lifting actually. So I think you need to be in normal range on a conduction study to consider that type of work, which is a bit of a pain, but it's how it is. Even like feeding the cat and dog, it was pretty difficult when I got home. Wasn't even sure if I could do that, because no one here to do it for me. So yeah, just things like that you got to overcome. You got to treat things as therapy. Household chores, see it as therapy. Doing the dishes, even holding a coffee mug, any household chores, vacuum cleaning, you've got to see it as therapy. Just do a little bit and gradually you can do more. Driving's therapy as well, because you're using your coordination with your hands and feet and all that sort of stuff. I go to car shows occasionally, just walking around a car show, same thing, you're doing walking, so it's therapy. But don't overdo it, it's the main thing. So I had these notes so I wouldn't waffle on, which is good. Yeah, it's mainly for people diagnosed with CIDP. Got no idea what it's like or heard of it before. So you get it from someone that's gone through it. That's still going through it. Hasn't been years and years ago. Still going through it. Yeah, it's a nasty disease, no doubt about it. Can't sugarcoat anything like that. Everything's uncertain, outcomes, prognosis. You'll get no clear yes, no from anybody, any doctor, about how things will go. It's just part of it. Yeah, you've got to have patience, a lot of patience. If you haven't got any, you'll get some. Just keep that hope of improvement that should occur. You'll get some sort of improvement. How much? No one knows. And keep active. Just keep moving, like those household chores I was talking about and different things. Yeah, just keep moving in that. Do physio. I still do physio. Been doing it, won't be long, it'll be like 10 months I've been doing physio twice a week. So that's really good. And just hope for the best, really. Get back to normal. May happen, it may not, but improvement anyway. Alright, so that's it. So good luck.